Welcome back, everyone. It's time for some girl talk. Alana went out to the Institute for Women's Health to get this week's scoop on something you ladies might be going through and not even know it.
Ladies, it's Tuesday. That means it's girl talk time, and we are going to discuss something that every woman's going to experience, if not now, later in your life, and that's menopause. And here to tell us much more about it, we're talking to Dr. Casiano from the Institute for Women's Health.
Thank you so much, Alana.
So we're talking menopause. Tell me some of the most commonly asked questions that you get with women in menopause.
When a woman comes to the office, she'll ask, am I in the menopause? And if I am, do I still need to use contraception at this point in my life? The common term now for the menopause is we use the word menopausal transition.
Okay.
Because the way we look at it now is that it's a continuing change in a woman's life. It starts somewhere around the age of 46. Extends into the age of about 51, 52, lasts about 5 years. Some of the studies out there show that it can last as long as 8 years. And what I tell patients, the way I try to frame it is I always tell my patients going to menopause is not like walking into a room and flipping a switch. I'm in the menopause. I tell them it's a continuous process, and it keeps changing monthly, yearly, and as things change, there are different things that happen to a woman's body. To make the diagnosis, what we usually do is we go by the symptoms, number one. Once we get past that point, we start addressing the various symptoms. Probably the most common thing that brings women into my office is menstrual irregularity. What I try to do in terms of how I approach it is I tell patients, first of all, let's sit down and talk about what your periods used to be like. Let's go over the menstrual cycle. Let's talk about the different hormones at different days of the month and kind of break it down from there. Once we get past that point, then it's easier to approach the different treatments available. What I tell patients in terms of treatment, I think it's important once we get past the explanation phase and we say, okay, this is the physiology, these are the hormones, then we can sit down, for example, with the menstrual irregularity problems and say, okay, we know exactly what the hormone is. We know what's missing, and I can replace this without causing any other side effects and other problems. The other thing that comes up too is the problem with sleep. I always tell my patients somewhere around 40 to 50% of American women suffer from insomnia. Women have trouble sleeping. No one really knows why. And in this menopausal transition, the problem becomes worse. And so a lot of patients have trouble getting to sleep, staying to sleep, and again, a lot of this is hormonal that we can work on.
So what you're telling me is there's hope at the end of the tunnel. If you happen to have any of these symptoms, I guess you would, of course, suggest to go see your physician, and each woman is different to be treated.
Of course, and that's what I tell my patients. I tell them no two women go through the menopause in exactly the same way. It's very different.
Always, always important information. So if you would like to get in contact with the Institute for Women's Health, they are on 18707 Hardy Oak Boulevard, Suite 230. They also have several other locations that I'm sure there's one near you. The phone number is 494-2000, the website ifwh.org. They're on Facebook and they're on Twitter. And here's something they also want to make sure that everyone is aware of. They will be holding a health fair on March 29th at the Hardy Oak Medical Pavilion parking lot. It's from 10 a.m. to 1 p.m. So you can get a lot of other wonderful, helpful information there.